We welcome you to our module Atrial Fibrillation, HCC 96 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of atrial fibrillation. At the end of this module, the learner will be able to explain atrial fibrillation and its cause, discuss the criteria for the documentation of the disease, identify the ICD-10 codes that fall under atrial fibrillation, review the example of the assessment and plan for the disease, identify the exceptions to keep in mind while coding for atrial fibrillation. Atrial fibrillation, also known as an arrhythmia, is an irregular or abnormal heart rhythm. It occurs when the heart's upper chambers, the atria, beat irregularly, out of coordination with the lower chambers, the ventricles. Resultingly, the heart cannot pump blood to the body efficiently. Normally, the heartbeat starts from the right atrium. However, for people with atrial fibrillation, there are multiple spots that trigger the heartbeat, which means that both the upper and lower chambers work at their own pace. The CDC estimates that between 2.7 and 6.1 million currently suffer from atrial fibrillation. Usually, there are no symptoms to begin with, and people are unaware of their condition until it is discovered. Patients may experience weakness, dizziness, a reduced ability to exercise, chest pain and shortness of breath. Conditions such as high blood pressure, heart attack, coronary artery disease, metabolic imbalance, viral infections, sleep apnea and exposure to external stimulants such as tobacco and alcohol. There may be a rare chance that a person may get atrial fibrillation without having any heart defects. That condition is called lone atrial fibrillation. It is rare to get serious complications during lone atrial fibrillation. The criteria for the diagnosis of atrial fibrillation requires a physical examination or an electrocardiograph. Here's an example of the findings of the physical examination. Irregular rhythm in the cardiovascular system will support the condition. Let us look at the different ICD-10 codes that fall under atrial fibrillation. For paroxysmal atrial fibrillation, the code is I48.0 and the HCC is 96. Chronic atrial fibrillation, the code is I48.2 and the HCC is 96. The code for atrial fibrillation is I48.91, HCC 96. And lastly, the code for the history of atrial fibrillation is Z86.79. The assessment and plan should address the diagnosis as current and include two support indicators. Let's see an example of a progress note for atrial fibrillation. Patient name: Jesse O'Connor. Date of service: November 20, 2019. Date of birth: December 13, 1979. Assessment and plan: Chronic atrial fibrillation, I48.2. Stable. No symptoms. Continue follow-up with cardiologist. Continue warfarin 2 mg from Monday to Saturday, then 4 mg once daily on Sundays. Control verapamil ER 240 mg daily. INR ordered next 2 days. Follow up in 1 month. Exception: while coding for atrial fibrillation, it is important to remember that it should be coded as a personal history of when a patient had ablation treatment and there is no current medication and/or symptoms. We have reached the end of our short refresher course on atrial fibrillation. We gave you a short introduction to the disease, reviewed the criteria for the documentation of AFib, identified the specific codes and HCC category pertaining to the disease, and finally discussed the exceptions which are to be kept in mind while coding for atrial fibrillation. Thank you for joining us.